Our mainstay of treatment innovation for so many years in cardiology, and specifically here at HonorHealth, was in the management of coronary artery disease. But what's really changed over the past several years is the treatment of other diseases: valvular heart disease, structural heart disease. There's a number of new therapeutic modalities aimed at treating patients who were not candidates for treatment just a half a dozen years ago. And in the last 5 or 6 years, now it's becoming routine that these patients who went to hospice come into the hospital for one of these new treatment modalities, and they go home a day or two later. There's a new technology called balloon lithotripsy for patients who had heavily calcified, really hard plaque, heavily calcified coronary arteries, where we take a specialized catheter that shoots lithotripsy waves into the artery and modifies the plaque and sort of softens the calcium. And in doing so, it's a new technology, a new therapy that allows us to then take a stent previously impassable into the artery because of the calcium, and now pass that stent and deploy that stent. This is really exciting technology. HonorHealth is one of the first 5 or 6 hospitals to roll this technology out.
It's important, if you're going to be on the cutting edge of cardiovascular care, you have to be involved in trials, you have to be involved in research. All of this stuff happens because of research. Dr. Reisig has been involved with many different trials for stents and percutaneous coronary intervention, basically being able to open up arteries when they're blocked. And he's been a pioneer in that technology, so been first in the United States for some of those stents, which is really a point of pride for our group. You know, being able to say that we've been able to help advance the science and bring this technology to our patients in a way that really nobody else can do locally, just because we've been involved with the research for such a long time.
The greatest cardiovascular minds on the planet come as faculty to teach at Scottsdale Interventional Forum. One of the things that we're most proud of is the fact that we have an evening symposium, but not for doctors and nurses, but for the lay community, for the Scottsdale and Phoenix community. The community comes to this meeting with questions about their health. What if I have coronary disease? What if I have valvular disease or structural disease of the heart? What are my options? And they leave there very satisfied that now they have some direction.